Talking with Jonathan Emerd, an attorney, and we're here at the Health Freedom Expo. Can you talk about health freedom and how much freedom do individuals really have when it comes to their own health care?
Well, it's unfortunate, but most Americans are increasingly losing their freedom of choice. When it comes to self-help, they're severely encumbered because nutrient disease information, which is prolific in the academic literature, is not permitted by federal law to be present in the marketplace. So, for example, it took a Supreme Court, or took the United States District Court, the United States Court of Appeals decision that we won in several years ago against the Food and Drug Administration in Pearson versus Shalala to get folic acid and neural tube defect claims into the market. And typical of what the agency does, it suppressed that information for over 5 years. And the consequence was an estimated 2,500 preventable neural tube defect births a year, as well as countless NTD-related abortions. But it took a 5-year-long court battle against the agency to ultimately get a First Amendment decision striking down that and a number of other bans on specific nutrient disease relationships. Yet, even after the decision, with a constitutional mandate to the agency refused to implement the mandate and has consistently favored suppression over disclosure. As a consequence, you can't get even basic information such as prune juice as a treatment for chronic constipation on a bottle of prune juice. As a result of this, consumers fail to have the information at the point of sale necessary to distinguish among products and to make informed choices, which then redounds to their detriment. And by making poor food choices and poor supplementation choices or no supplementation choices at all, people really do reduce their health and diminish their likelihood of being able to live a long and prosperous life. In addition, in the healthcare marketplace, increasingly the government plays a significant role through the insurance carriers in second-guessing the judgment of physicians. And increasingly we have a one-size-fits-all environment. When you combine the imposition of Medicare on the practice of medicine and the state medical boards, you end up with an environment where doctors are constantly fearful of audits or being second-guessed or having complaints filed against them. So frequently, against their own professional judgment and best interests, they will choose a course of treatment that is likely to be uncontroversial or not to be questioned or not to make them look like an outlier. And that is over a tailored system of care for you. When the Patient Protection Affordable Care Act comes into place in January 1, 2014, the environment will worsen in that regard. Choice will be restricted even further because the government will, for the first time in American history, place a mandate on all American citizens that they have health insurance. And if you're not currently insured, you will have to buy health insurance at a rate of about $5,000 to $15,000 a year. And some 40 million or 50 million Americans will instantaneously be legally obliged to buy that insurance. And it will be available only through qualified health care plans, those that the HHS Secretary deems qualified, that are national in scope, and that provide a set of services that are government approved, which will very much be the same as Medicare services. So alternative care is viewed by Medicare as uncovered, not covered by Medicare, and not medically reasonable and necessary. So all sorts of innovative care, not just alternative care or integrative medicine, will be forbidden outside of the realm of protected, insured services. So doctors will increasingly be pressed into providing only those services for all patients that are government approved, and those who don't provide such services, because now we have a universe of all people in the system, will be regarded as providing care that is substandard, beneath the standard of care, or negligent in their provision of care. So it will squeeze out of existence alternative medicine and it will dry up all of the funds that otherwise would be available to pay out of pocket for alternative medicine, and will make of the insurance industry, like the drug industry, state-sponsored monopolies.